Okay, I am going to re-review the concept map. I don't think anybody watched the video that I posted before you attempted your first concept map. You can go back and rewatch that video. It does show me if you clicked on it, so I know that you didn't watch it. So I'm going to review again. Let me share my screen. Okay. And open this up. All right, so we have this concept map example. So we have your admitting diagnosis, which was obsessive compulsive disorder. And then your assessment findings come directly from the vignette. They're going to be subjective and objective data. Assessment findings. He's a 57-year-old attorney. He reports worsening symptoms since the loss of his court case. He has increased consumption of alcohol. He's frequent hand washing. He's no longer able to work. He has extreme fidgetiness and anxiety. He's washed his hands several times during the interaction. So then we have first client problem, anxiety. How do we know that he has this? Frequent hand washing, increased consumption of alcohol, the fidgetiness, no longer able to work, washed hands several times. What's our interventions? Reassure client of his safety, keep the immediate surroundings low in stimulus, teach the client signs and symptoms of escalating anxiety. These are how we're going to intervene. These are nursing interventions. And then client problem number 2 would be ineffective coping. Right? If you have a nursing care plan book, these are coming right from there. Ineffective coping, how do we know he's not coping effectively? He's not working, he's drinking, he's very fidgety. You can see how these things are overlapping. Okay? And then we go to interventions. We're assessing, we're teaching, we're giving reinforcement. Okay, you notice that there's not just 1 or 2 words in each box, there's full sentences, because this is a nursing care plan, but put into a concept map. Think of this thing as if someone who's never been in nursing before picks your care plan or your concept map up and looks at it. They're going to know exactly the picture of what's going on, what the patient looks like, how the patient's acting, whether or not the patient is, having positive like they're going to know all these things. So ineffective impulse control, again, increased consumption of alcohol, all the things that he was doing with the other ones. Interventions, ensuring a non-judgmental attitude, practicing stress management techniques, offering support, encouragement when setbacks occur. Now we're looking at our client outcomes. Client will verbalize signs and symptoms of escalating anxiety. Client will demonstrate the ability to interrupt obsessive thoughts and refrain from ritualistic behaviors. The client will be able to demonstrate adaptive coping strategies in response to stress. We want client outcomes to be something that are reasonable to achieve, things that are measurable, things that we can say, this patient did this at this date, and yes, that means that our interventions worked. Your client outcomes have to match your interventions. Your interventions have to match the problem, or you will get those particular parts of the assignment wrong. The other part that people missed was in the beginning, there were questions. And there were discussion questions. Some of you missed those. If you look back on the assignment in the page where all the directions were, there was the questions that you were supposed to complete. So week 2 is now done. I'm finished grading the first set. I sent you notes on how to improve. Rewatch the first video that I posted before you even attempted the concept map, and watch this video.